Welcome to this medicine masterclass in which we will discuss multiple sclerosis. Multiple sclerosis is a neurological condition caused by discrete plaques of demyelination occurring at sites throughout the central nervous system caused by a T-cell mediated response. Demyelination heals incompletely, resulting in relapsing and remitting symptoms. Prolonged demyelination can result in axonal damage, resulting in progressive symptoms. The mean age onset is of 30 years old, and there's a female to male ratio of approximately 3:1. There are multi-system presentations. Eye signs include unilateral optic neuritis, resulting in painful eye movements and loss of central and colour vision. As a result, patients may develop a relevant afferent pupillary defect, diplopia, intranuclear ophthalmoplegia, hemianopia, and optic atrophy on fundoscopy. Sensory changes include dysesthesia or paresthesia, pins and needles, and trigeminal neuralgia if the trigeminal nerve is affected. Motor signs include spastic weakness, transverse myelitis, as well as cerebellar symptoms such as trunk and limb ataxia, intention tremor, scanning speech, and falls. Patients can also develop autonomic dysfunction with urinary retention or incontinence requiring self-catheterization, as well as erectile dysfunction, anorgasmia, and constipation. There are some important eponymous features associated with multiple sclerosis. This includes Uthoff's phenomena, in which symptoms and vision worse on increased temperature, such as during a hot bath, hot meal, or exercise. Lermit sign is when neck flexion causes an electrical sensation in the trunk and limbs. This is also seen in cervical spondylosis, core tumours, and subacute combined degeneration of the spinal cord. Another effect is the Pulfric effect. This is where latencies between the eyes, where the optic nerve has been damaged on one side more than the other, for example, can result in visual disorientation. Straight lines may appear curved because they're processed faster on the unaffected side than they are on the damaged side. There is a condition that you should discern multiple sclerosis from, and that's Devic syndrome. This is a variant of multiple sclerosis, but with a worse prognosis. Relapses are more frequent and severe and associated with a transverse myelitis. Anti-NMO antibodies, anti-neuromyelitis optica antibodies may be present, and these patients will require plasmapheresis and more aggressive interventions. To diagnose multiple sclerosis, we use the McDonald criteria. This requires lesions to be disseminated in time and space. CSF oligoclonal plans of IgG on electrophoresis that are not present in the serum and raised protein are also suggestive. If you find anti-NMO antibodies, this will be suggestive of Devic's disease. The MRI would demonstrate demyelination and abnormal areas in the periventricular white matters, and you'd also see gadolinium enhancing lesions or more than 9 T2 hyperintense lesions, and these lesions will be disseminated in time and space. Visual evoked potentials. Despite normal vision, there may be a prolonged latency in the cortical response to a pattern stimulus, indicating a delay in conduction in the visual pathway. As a result, a number of investigations patients undergo. Anti-NMO antibodies are useful to discern from Devic's, oligoclonal bands in the CSF and the serum, MRI of the brain and spine, and visual evoked potentials are the key important investigations. To manage these patients conservatively, we optimize comorbidity and involve the MDT, a multidisciplinary team, to support the patient as much as possible. Medically, options are limited. For relapses, methylprednisolone pulsed can be used, and this should be used sparingly. Interferon alpha or beta, glatiramer, natalizumab, and azathioprine are also therapies that are used to help treat multiple sclerosis. This is a progressive condition and palliation needs to be considered. Spasticity can be treated with dantrolene, baclofen, or diazepam. Urgency and frequency require the patient to intermittently self-catheterize or use oxybutadine and tolterodine. Thank you for attending this medicine masterclass.